All right. So let's talk about treating people with mental disorders and not driving myself crazy because I can't turn my phone's volume all the way off. Because the only way that I can see your messages is to have my phone here on the Google call because reasons. Anywho, let's go ahead and get started. So, psychological treatments. Basically, some of the questions that we're going to be taking a look at today are basically how are psychological disorders treated? What are the most effective treatments? We're going to skip past the can personality disorders be treated because, yeah, they can. There, I just answered it. Good. And then we're going to talk about treating disorders in children and adolescents. And that's something that is very controversial in the field of psychology itself. So we're going to talk a little bit about that as well. All right. So, first things first, how are psychological disorders treated? Well, in order to understand how they are treated today, we need to talk about how they were treated so very long ago. And by long ago, I mean not that long ago. Psychological disorders, the treatment for them, we've talked briefly about this, but they can be summed up in basically one word: abuse. That's how they were treated. People with psychological disorders were treated quite badly. Oftentimes, they were put into prison. If your town was lucky enough to have an insane asylum, you might get chained up and imprisoned in the insane asylum. But it was incredibly dark, filthy conditions. You were basically just ignored. Some treatments that people got, things like starvation. Well, if you're going to act crazy, you don't get food. Beatings. If you're going to act crazy, I'm going to beat you. And isolation. If you're going to act crazy, here, be in this room by yourself for the next several hours or days or weeks or for the rest of your natural life. Obviously, these did not actually help people. People were not treated with them, but this was considered a treatment by these people. By 1793, a French physician named Philippe Pinel, believed that we should actually start to study people and maybe help them. What a concept. So yeah, that's basically what we started doing. We tried helping people with mental disorders. And it was done very carefully. It was basically watch them, observe them, and help them if possible. And that's going to start the process of what we now call psychotherapy. Now, psychotherapy is a wide-ranging idea. Basically, there are lots of different types of psychotherapy out there, as psychotherapy is any form of treatment for which a therapist works with a client or patient. Therapists are people who use psychotherapy to change their clients' or patients' patterns of thought and behavior. So that is kind of a blanket term for most psychologists, is they get the term of therapist. So yeah, psychotherapy is what we're going to be talking about in large part today. We've talked a little about this, so we're just going to keep moving on past this, but the different types of therapy that are out there are different ways of dealing with things. So one of the first methods of psychotherapy that was pioneered at the beginning of the 20th century is going to be the psychodynamic approach through Sigmund Freud. And he used psychoanalysis to treat people with unseen mental illness, basically mental illness that had no biological or physical manifestation. You couldn't, point to a part of the brain that was, covered in lesions. You just had people who were anxious or people who were depressed or people who were having these problems that just couldn't be explained. So the way that Freud explained them was, it's the unconscious, stupid. Okay. If we have unconscious conflicts going on deep buried inside of us, then we need to resolve those conflicts so that we can have a chance to be able to move on. And so the unconscious mind was the center of all of the behavioral and cognitive issues that people were experiencing. How do you get to them? Well, he would sit behind his desk, and his clients or his patients would lie on a couch, and they would start talking. The process of free association that we've talked about several different times during the course of this school year. Free association is one way to get to the unconscious. Basically, you allow the person to talk and talk and talk and talk and talk and talk and talk until their conscious mind runs out of things to say, and then their unconscious starts talking. You can also study a person's dreams, specifically if they are having recurring dreams. Freud liked dream theory, but generally only when there were reoccurring dreams, so dreams that you have over and over and over again. Basically, that was what was going to allow you to be able to get to those underlying issues of the unconscious. Another type of psychotherapy out there is the humanistic approach. The humanistic approach was pioneered by people like Carl Rogers and Abraham Maslow to help clients reach their full potential. Client-centered therapy is a safe and comforting setting for the people who are seeking therapy. It involves active listening by the therapist. So it's not just, sitting there and letting you talk until you talk yourself out, but it's actually responding to you and building that sense of unconditional positive regard that we talked about in our last unit when we talked about different things. Generally speaking, it's also done in group therapies. We'll talk about why group therapy in a little bit, but basically it's a number of people all kind of working together, trying to get their therapy worked through at the same time. Another type of therapy out there is behavioral therapy. This is the use of positive and negative reinforcements and positive and negative punishments to change a person's behavior or their thinking. An example of this, like a cheap and dirty version of behavioral therapy, is if you've ever taken a rubber band and worn it as a bracelet, and then every time you start doing something that you don't want yourself to do anymore, you just kind of reach back and snap it and hurt yourself. So every time you want to yell at somebody, you just snap that wrist and like, okay, don't do that. That's behavioral therapy. It can be small like that, or it can be bigger and involve larger punishments. But basically behavioral therapy works, so that's why we keep using it. We also have cognitive therapy. In this case, you work to change the thought patterns of the individual. Any kind of distorted thought pattern is rethought, basically. Cognitive restructuring. Basically, you have to work with a therapist to think about things in a different way. You also have rational emotive therapy, which kind of does the same thing, but with your emotions. It helps to eliminate emotional blocks that keep you from being able to move forward because of the way that you're thinking about things. So cognitive therapies are quite popular. Currently, in psychology, however, probably the most popular form of therapy is cognitive behavioral therapy. Here, your therapist help you to reconstruct your entire thought process to replace distorted thought patterns with more realistic ones that are more positive. For example, a maladaptive pattern would be, my boss yelled at me because I'm worthless, and that makes you feel bad and makes you depressed. But after you go through the process of cognitive behavioral therapy, it's, my boss yelled at me. He was just having a bad day. I'm not a bad person. He was just having a bad day. it's not a problem. Cognitive behavioral therapy, like I said, is extremely popular right now in the field, mostly because it gets results and it gets them really quickly, like disturbingly quickly. Like most psychologists who don't believe or practice cognitive behavioral therapy really don't like it because it's kind of eating into their practices. Okay, psychoanalysis takes years of therapy to get through, weekly sessions for years. But cognitive behavioral therapy can be effective in as little as 6 weeks. So you can see why it's very, very popular in the field of therapy, especially the field where they have to care about how much things cost. Okay. I actually saw or not saw, but I listened to a podcast, and a few years ago they sent somebody to a therapist to go through cognitive behavioral therapy. They did a truncated 1 week mega session. Typically, it's something that's kind of spread out over 6 weeks. So 1 week you're working on this, the next week you're working on the next thing, and the next thing, and the next. And what this journalist found was that after the 1 week of intensive cognitive behavioral therapies, they felt a lot better about whatever it was that they were thinking about. I don't remember what it is. I need to listen to that episode again. But I do know that after having listened to that episode, I went, holy crap, we need that here. Why are we not doing cognitive behavioral therapy in the high schools? Because that's exactly what we need to be doing. Because there are so many maladaptive thought patterns that happen on a daily basis. You get a bad grade on a project or a test or an anything, and immediately that brings up all these horrible thought processes that lead you to mental illness and psychological disorders like major depressions and anxiety and all kinds of different things. Why are we not using this? We should be using this totally. And I had to kind of put that on pause when I went off to get my second master's degree, because that took up all of my time. But now that I'm almost done with that, I want to get back into this cognitive behavioral therapy and helping students throughout the entire school to, get some help at thinking differently. Another reason why a lot of therapists out there today don't like cognitive behavioral therapy is the simple fact that it doesn't actually fix the underlying problem. It just kind of paves over the top of it. So instead of fixing the pothole, it just kind of puts a new layer of asphalt right over the top of it that you don't even see the pothole anymore. Look. But of course, over time, that pothole is going to come back. So you put another layer of asphalt over the top of it and it's gone again. So that's what a cognitive behavioral therapist would argue. And that's why they advocate for its use. Hold on just a second. Oh, that's good. All right. Now, over the course of the rest of this presentation, we're going to talk about how cognitive behavioral therapy works really well with a lot of different disorders. And it does. But it's not the only thing that's out there. Okay, so just understand that. Anywho, the context of therapy actually itself matters, specifically with regard to whether or not you're doing it by yourself and doing it one-on-one, or if you're doing it in a group. Group therapy has a very obvious benefit, and that is cost. Okay, a therapist can be very expensive, especially if they've had a lot of experience or education. They could be very, very expensive. Group therapy basically takes that and splits the cost amongst all of the people in the group therapy, and is really actually incredibly beneficial. There are lots of different types of group therapies out there. There are groups that are organized around a particular type of problem, whether it be substance abuse or sexual abuse or there's all kinds of different groups out there. Or it can focus on a particular type of client, whether it be a particular age group or racial or ethnic group. It can be very very beneficial for those types of um, group creation. So there's lots of different types of groups out there, and they are still beneficial. There's even family therapy. Family therapy helps when there is a systematic um, problem inside a family dynamic. Um, Family therapy can help because you can see how the family dynamic actually operates, as opposed to just getting one side of the story, from mom or from child or from dad or from grandma or from auntie or from whoever's inside the family circle. It allows for people to be able to see the psychological disorder in the larger context of the individual's family unit. Okay, and that can help to not only diagnose things but also to treat things. Because if you are experiencing depression for whatever reasons, um, if you're experiencing that depression, um, you can you know train mom and dad to you know treat it as opposed to making it worse, which I'm sure many of you would really like to have happen. One of the larger things to affect the effectiveness of psychotherapy is cultural beliefs. Cultural beliefs affect treatment. Uh, Sometimes societies or cultures will have a somewhat dim view of therapy. And so um, it can be, looked down upon. Oh, you're going to therapy? Oh, so there's something wrong with you. And that's not necessarily the case. And a lot of times it's just that we need a little bit of extra help. Um, Psychology, for all of the good things that has happened with it over the last 50 years, does still have a lot of baggage. One of the largest and heaviest bags that psychology has to move past and move beyond is the simple fact that for a very long time, psychology was basically for middle class white people. And that was about it. And therapy sessions for people of color, and people who were in different socioeconomic groups just didn't exist. And so it was looked down upon by those groups as being something for other people, not for you. And so um, it can have an impact on the effectiveness of the therapy itself. Um, we are getting better as a field. Psychology has gotten better. It has become more inclusive. Psychological studies are now not just of middle upper class white college students. There, it's including larger and larger groups of people. So that's good, right? I mean, it has to be, right? Uh-oh. Oh, sorry, I gotta check something. Just one sec. Is this going to be a happy day or is this going to be a woohoo? Hot damn! It's going to be a happy day. Right? I am reading that correctly. Hold on. Want to make sure that I'm not. Okay. Cool. All right. Oh. Whew. I just got the results from my comprehensive exam. I passed. Yes! I don't have to take that stupid test ever again. For my master's degree. if I didn't pass the test, I have to take the test again. I don't have to take the test again. Thank you, God. I don't know. I don't care. It's a pass. Yeah, I don't care if it's 1 point above passing. I passed. Huh? 4 hours. Yeah. No, it was whew. Oh. Who else wants to take a nap? Because I just want to take a nap right now. Okay. Did you pass?
I haven't checked.
Wolf.
Did you check?
Yeah.
You passed?
Yeah. For God's sake, man.
Where do I check?
They sent you an email.
That's it?
Go ahead. What am I going to do? Say no?
Yeah. I can't do it on my phone. Tell them what this is all about.
Yeah. I'm online right now. and nobody at home is paying any attention because there's one. Nice. Yeah.
I walked away, dude. I took 3 sips of the glass, dude, and walked out. I'm over it. That's what I told you, dude.
Oh. Whew.
Is it an email?
Yeah.
It's the only one that doesn't pass, dude.
Oh, knock it off. You're fine.
You guys had to take the test in person?
No, we had to take it online, but we had to have somebody watching us on camera. Yeah.
Did you get checked by them at all?
Like what?
So I'm in my boys' room, my 12-year-old boys' room, and the bathroom's right next.
Mm-hmm.
We share a wall. So my 16-year-old boy gets in there and starts his barking thing with his nose, dude. And when he goes nose, like over and over and over. To the point that I get up and I go like this to him. And then all of a sudden, something comes on with the computer and goes, "Sir, what are you doing?" Checking me, dude. Checking me. I had to recheck my walls and my desk or whatever.
No, but I had to get up. I had to get up almost every 20 minutes for an hour because the dog needed to go out over and over and over again. And so I'm like, I gotta go let the dog out. Hold on. And I'd go and I'd let the dog out and I'd come back and they go, "Can you do a sweep of the room?" Yep. That was too fast. Can you go slower?
Wow, really? Yeah.
There's the fish tank over there. Okay.
Okay, so it's hooking up to my school Gmail account. This sucks, dude.
Sorry for the interruption, everybody, but this is important.
Oh, did I miss?
Oh, you're fine. Don't worry about it.
I'm sorry, guys. Sorry. You mind?
See, they don't mind.
I can't. How do I change?
Dude, good Lord, dude. You're in an instructional technology course and you can't.
Okay, so what I should do is, see, I'm in Blackboard logged in, but okay, but like, so I need to log out of my Gmail.
You see if it's in.
Here, I'm gonna log out.
Can you log in
I could try.
via the computer? Okay, so put you into guest mode.
Oh, is it my Coyote?
All right. So anyway, as Mr. Ramos tries to figure out whether or not he passed, the tension, you can feel it.
If I didn't pass,
Oh my God. Oh God. That's such a weight off my mind.
Is it the final test for this week?
Yeah. Basically, I have to pass the classes that I'm taking right now, but I needed to pass that test,
Be over.
and then it's over. I've got about 3 weeks left in my classes, and then the summer to work on a project and finish that, and then
Get your degree.
done. Yeah. Is it loading?
pass, bro.
Wahoo!
Oh my god.
uh,
You don't even know. You don't even know, guys. You don't even know.
woo! Hot damn.
Thank you, Rob. Pulling out your butt tonight. Pulling out your butt tonight.
So if any of you have Mr. Ramos, make sure to congratulate him on passing his comprehensive exam. And if you had Mr. Ramos in the past, send him an email. I'm sure he'd love to get the congratulations you passed. Oh, hot damn. Whew. Oh. Yeah, I'm just it's that moment of just releasing all of the pressure that has been, building up, because, I took this test 2 weeks ago, and I've been, counting down. Like, is it time? Is it going to tell me? Is it going to tell me? So, no, but yeah, it's hyper specific. And so you really have to know what you're talking about, but you don't know what the questions are going to be about. So it could be about literally anything that we talked about over the course of the 2 years of this entire degree program. So it was just like, oh my God, what are they going to ask me about? What if it's something I don't know anything about? So it is a little nerve-wracking in that way. But ultimately, sit down and you start writing, and then you just keep writing. And whew. Yeah. Okay. So let's get this focus back on me. All right. I'm sorry, everybody. We took a detour. So there are also biological approaches. There's also biological approaches that we can take to treating people with mental disorders. And most Commonly, it is going to be through the use of psychotropic medication. These drugs affect mental processes by either adjusting neurotransmitters or preventing the reabsorption of neurotransmitters. It has something to do with the rebalancing of, the neurotransmitters inside of our brain. And that's what these medications are trying to do. There's lots of different types of drugs. I'm not going to go through those, but we will talk a little bit about each one of those in just a second. Another type of biological therapy out there that is not very widely used any longer is electroconvulsive therapy, or ECT. Oftentimes it is referred to by the name shock therapy. Basically what they do is they take like a little rubber plug and they put it in your mouth so you don't shatter your teeth. And then they take these electrodes and they put them on either side of your temple, and they basically shock your brain into basically shutting off and restarting. During the process of restarting, your brain basically is completely and totally off. You are unconscious. This was actually the preferred method of putting people under anesthesia for the transorbital lobotomy, which we'll talk about at the end of all of this, because that's not a thing anymore. But basically, you knock the person unconscious by shocking their brain into kind of restarting, and when they come back, they sometimes feel better. We don't know why, for sure. There's a lot of theories, and honestly, I'd like to know how the first person who got ECT, what they thought they were going to get out of it. Let's just try and electrocute their brain, see what happens. Woo! ECT is usually only used for people who are suffering from severe depression and aren't responding to medication. So if you're depressed and you're experiencing these things, it will simply manifest itself and then continue, and it can be really, really dangerous. Another form of therapy, which I'm not very familiar with, is transcranial magnetic stimulation, or TMS. This is something I have not heard very much about, but from what I've been able to gather, it basically creates a very strong magnetic field that alternates, that can interrupt brain function in a particular region. So I guess that's a thing. Like I said, I am not really that familiar with it. Again, it's mostly used to treat severe depression. We also have deep brain stimulation. This is where they place a pulse generator in your chest and run electrodes up to your brain. And then that is used to stimulate your brain into activity, or to decrease the amount of activity. This is often used to treat people who are suffering from obsessive compulsive disorder, as well as major depression. There was a video that we would have watched if we were in person, a short video that we did not watch this year. But basically, it talks to a psychologist at, well, she was at UCLA. I'm not sure if she's still there or not. She may have died for all I know. It's a very old video series. Anyway, she suffers from something called dystonia, which is she has the inability to control her motor neurons. And her dystonia is, the way it functions is that she is always turned to the right. She cannot turn her neck to the left. Like, her neck can turn to the left, but she cannot control it. So she's always, talking off to the right-hand side. Well, they actually put one of these deep brain stimulation units into her, and when they turn it on, she can actually turn her head fully to the left and be able to look straight ahead without, having to force her head to move to one side. So that is a kind of an off-brand way of being able to use this kind of medication, but it is a way of being able to use that. It's another form of treatment. one of the questions that we have to constantly ask ourselves is whether or not the treatments that we are getting are safe and effective. Okay. I can wave a stick over you and say, ooga booga, you're cured, but that's not actually doing anything. And a lot of people who've gone through therapy have gone through things that don't actually have any scientific evidence that proves that they are good. Okay. For example, this is a depiction of rebirthing. Okay. Rebirthing therapy, quote unquote, has no scientific basis whatsoever. However, practitioners of such a therapy claim that rebirthing therapy can promote attachment and reduce traumas remaining from birth. How? It just does. Okay. If your therapist is not talking about studies have shown this or things like that, but they're just like, yeah, this is a system that works really well, ask them about if it's been scientifically studied. If it hasn't been, you might need to be in the market for a new therapist. Yeah, they want you out there with a pass. Okay, so just understand that therapies can be out there that aren't actual therapies. Some of them are religious teachings disguised as therapies. Some of them are just kooky out there. Some of them are cults looking like therapy when they are definitely not therapy. So what are some of the features that characterize evidence-based psychological treatments? First, the treatments vary according to the disorder and the client's specific symptoms. If you are undergoing a therapy where everyone gets the same therapy, so if I've got anxiety and you've got depression and we get the same thing, you have anxiety? Rebirth. Oh, you've got depression? Rebirth. Okay. That's probably not evidence-based psychological treatment. Okay. The technique is used in treatments that have been developed in laboratory settings by psychologists with input from behavioral, cognitive, and social psychologists. Okay, so a large group of people have created this idea and this therapy. And no overall grand theory guides treatment. Okay, instead, we see the adoption of specific treatment based on the evidence of its effectiveness. So Freud today would not be seen as safe and effective treatment, okay? Because there is no scientific evidence for him to say that I can cure you of your hysteria. Instead, it's his overall grand theory of the unconscious and all of the thought processes that go into that. So we would not view that as scientifically effective, okay? That's what we're talking about. We talk about those grand theories as the guide of treatment, okay? Freud had a lot of them, and all of them were crazy. So how widespread is psychological disorders? Well, pretty widespread. Nearly half of all Americans will meet the DSM's criteria for a psychological disorder at some point in their lives. Some of us will get it for a very brief amount of time. Some people will get it for a very long amount of time. And at any given year, 25% of the population is going to meet those criteria. Now, this is the number of people who go in for diagnosis. We're not even talking about the people who don't go in for diagnosis. Choosing the right treatment provider is extremely important for ensuring a successful treatment. Professionals must have the appropriate training and experience for the specific psychological disorder or life problem, and the person that is seeking help has to believe that the therapist is not only trustworthy, but also caring. If you're going to a therapist who is telling you, yeah, your parents are right, you're just a giant piece of crap, you probably should go to a new therapist. That's what I'm getting at. Okay, so not only do they need to have the proper training, they really do need to be empathetic human beings, most importantly. Now, medication. Medication in the field of psychology is prescribed only by psychiatrists who hold a medical degree. Psychiatrists are they are the most highly paid people in the psychological field because they have to go through med school. Not only do they have to go through getting a degree in psychology, they go on into med school so they can prescribe drugs. Typically, psychiatrists work at major hospitals, and they will treat people who come in with miscellaneous disorders and mental illness. But there are very few psychiatrists, which is again why they get paid a lot of money. If you're interested in medicine, go into psychiatry. Lots of money is available to you. And there's always going to be a job for a psychiatrist. Efforts are currently underway to give more practitioners, like clinical psychologists, the ability to prescribe medications. The only problem is that, you know, they're not doctors. They're just psychologists. At best, they have a doctoral in psychology and nothing else. And that you don't get to prescribe drugs if you're a doctor of psychology. But you do get to judge everybody that's around you, which is pretty awesome. I'm not going to lie. The most important feature to look for in a provider, again, is empathy and experience in the methods that are known to be safe and effective for your particular specific psychological disorder. I am actually going to post this slide up onto the Google Classroom for you to take a look at. It's got a lot of really great information about what it takes to be one of these types of psychologists. There are clinical psychologists, psychiatrists, counseling psychologists, psychiatric social workers, psychiatric nurses, paraprofessionals, and it basically kind of goes through the schooling that you need as well as the job opportunities that are open and kind of what the training looks like for a person who goes through that. But I'll put that up onto the Classroom so you can take a look at that in the not too near distant future. All right. So what are some effective treatments? Well, there are a lot of effective treatments, and they kind of go by the type of disorder that you're talking about, whether it be an anxiety disorder, a mood disorder. What's another disorder? God dang it. Sorry, my brain's a bit of mush right now because I don't have to take that test ever again. Oh. Anyway, so first and foremost, with anxiety and obsessive compulsive disorders, which again, obsessive compulsive is an anxiety disorder, they are best treated with cognitive behavioral therapy. Again, many psychologists don't like cognitive behavioral therapy simply for the fact that you're not actually fixing the problem. You're just covering it up. Just cover up the problem and it'll go away. Okay. Now, there is evidence that most adult anxiety are best treated with a combination of cognitive and behavioral therapies. For example, exposure, which is a therapy technique that involves repeatedly exposing a client to anxiety-producing stimuli or situations to reduce that person's fear. There's one particular train of thought or method of thought that basically says that flooding is the best way of being able to do that, which would be like take somebody who's deathly afraid of spiders and basically throw them into a locked room filled with spiders. They'll eventually get over it, or they'll have a psychotic break and, you know, be a gibbering wreck in the middle of the room. Either way, again, it's not a particularly good form of therapy, but that is what some people believe is good. Anti-anxiety drugs do exist. They are out there. They do help you to calm down and make people a little sedated. The effects of cognitive behavioral therapy last for actually a long time after treatment. Again, it's one of the main reasons why people like it so much. Not only is it effective, but it lasts a long time and it's fast. It like checks all the boxes, except for the one that says it solves the problem. It doesn't care about that. Let's just move past that. Okay. With specific phobias, you can go through what we call systematic desensitization. This is a process through which you basically kind of ease them into the room filled with spiders. Again, like a specific phobia, like, arachnophobia would be, I want you to picture a spider 3 miles away. What level of anxiety do you feel? Oh, like a 2. Okay. Now that spider is 1 mile away. Okay, that's a fast spider, but what's your anxiety level? Well, it's still a 2. Okay, now it's on the other side of the room. Maybe a 3. Okay, what difference does it make if it's 3 miles or across the room? It's still unable to get to you. You can still get around it. You can still kill it. Oh, I guess you're right. I guess that would be probably a 2 then. Okay, and then eventually you can get to the point where they're actually holding a spider in their hand. It is a method through which most phobias can be looked at. Here we have an example of this kind of systematic desensitization. We've got a little girl who is afraid of that dog. So she's kind of cowering behind mom, and that makes her feel safe. So she's okay there. But then the owner of the dog is like, no, it's okay. You can, why don't you pet the dog? And you can, it's okay. And then she approaches the dog, and the anxiety kind of decreases as the dog isn't attacking her. And then when the dog gets up and is like, oh, that's nice doggy, they're much happier and they are feeling better. Okay. So it's a way of overcoming those fears. And that's kind of where we're at with that. Now, we are starting to use new technologies to do this, and that's virtual reality is being used to help people with these anxiety disorders, especially with phobias, because you can put them into a virtual world where nothing can actually hurt them because it's all fake, but they can experience those things regardless. Okay. For example, I really don't like heights. Okay. I'm good. I don't want to be next to an edge of a high place. I'm good. Please keep me close to the ground. But I have seen, I don't know if it was it was a computer game. It was like a virtual reality game. And I'm not sure if it was designed specifically to help people get over their phobias, but there's this one game, you basically walk into an elevator and you press the up button, and it takes you to the top floor of a very tall building, and it opens and you're immediately on like a plank. And you're supposed to walk out onto the plank and look straight down. And the virtual reality is telling you you're very high up. But the reality is you're on the ground. And so that's a way of being able to go through that process of systematic desensitization or flooding to help that person to get over that without actually having to put them into any danger. Because if you were to take somebody who has a very bad fear of heights to the ledge of a building, they could hurt themselves. But in virtual reality, they're fine. So it's just a way of being able to do that. It's a way of being able to get somebody onto an airplane and get them to stop fearing flying, because you're on an airplane here. What's wrong with this? Oh, I guess it's not so bad. Right. It's just the same thing, except you're actually, doing it. Panic disorders. There's a lot of different ways that you can approach that, but probably one of the best ways of understanding or treating and therapizing, is that a word? Using therapy to treat panic disorders is the cognitive restructuring approach. Basically, you teach the person who is undergoing these panic attacks and these panic, this panic disorder, to understand that it's just a panic attack. It's not life or death, And that actually does really help people to kind of come back from the edge. God, I want to say it was about 3 or 4 years ago. I had a student who he suffered from panic attacks, and he at the beginning of the year kind of quietly suffered through the panic attacks, and then one day he said out loud, I'm having a panic attack right now. I'm really freaking out. And all it really took to kind of get him back into reality was we're here, focus on something, look at something and focus on that thing, something that's in the room, something you can see. Then once you focused on what you can see, what can you hear? Then what could you taste? Look at something in the room that might have a taste. Think about what that tastes like. It's basically what we call grounding, where you bring the person back into the reality of the situation. And that is a cognitive therapy. It's a cognitive therapy method. And once you kind of get yourself regrounded, okay, the panic attack is gone. And at least we'll make it go away at that exact moment. Does it fix the problem? No. But, it fixes it temporarily. And isn't that enough? All right. Obsessive compulsive. We've kind of already talked a little bit about that. But basically it requires you to expose that person to the thing that causes them the anxiety that they then obsess about, and then forms the compulsion that makes them do the odd behavior. Again, medication can sometimes help. Deep brain stimulation can sometimes help. But cognitive behavioral therapy is pretty much the best way of being able to help these people. So we've talked about that. So we're going to move on. So let's talk about another set of disorders and how you can help to treat that through the field of psychology. This next one is depressive disorder. So basically mood disorders. There is no best way of treating depression. There's just a lot of different ways to treat depression. For those of you who don't know, this is Jon Hamm, and I hate this man. Not because he's a bad person, not because he's not a good actor, because he is a fantastic actor, because look at him. I mean, for God's sakes, how can you look like that and be depressed? Seriously. And he's hilarious. Like, he's good at dramatic acting and comedic acting. What the hell? I don't actually hate him. I just want to be him. Anyway, after the death of his father when he was 20 years old, Jon experienced large amounts of depression, and he's actually been pretty public about his experiences with depression. He also credits the use of psychotherapy as well as medication to help him overcome his disorder. He says using antidepressants, you can change your brain chemistry enough to think, I want to get up in the morning. I don't want to sleep until 4 p.m. I want to get up and I want to go to work and I want to get going. It's priming the pump. It's getting it so that you're able to do something, and then being able to do something helps to drag you out of the muck of the depression. That's how he views it, and it's how a lot of therapists view it as well. The medication is there to kind of get the ball rolling, and then once the ball is going, just keep it going, and your depression is long over. One of the largest groups of medication that is prescribed by psychiatrists are antidepressants, and there are a couple of different types of antidepressants out there. The most widely used are selective serotonin reuptake inhibitors, or SSRIs. These are medications that have very, very few side effects that are very serious. They tend to be the first things to be used. Probably, I would say probably the most popular SSRI out there is Prozac. Prozac is a medication, an antidepressant that is prescribed by many doctors. And basically what it does is it keeps your receiving neuron from, or your sending neuron from reabsorbing the serotonin that doesn't get sucked up by the receiving neuron. So if you remember back at the beginning of the year when we talked about neurons, playing catch, one pitches, one catches, okay? The serotonin that doesn't get sucked up by this is just left over, so the other neuron basically takes it all back. Well, what this medication does is it keeps that from doing that and keeps it out there, keeps the serotonin out there so that this can keep sucking it up and improves your mood. Okay. About 60 to 70% of people who take antidepressants experience relief from their symptoms. And that is compared to the 30% in the placebo trial that they did. So they do actually have a rather large impact on people. Another way to treat depressive disorders is cognitive behavioral therapy. Again, it's about changing the method through which you think and then changing the behaviors that lead to those thinking patterns. So it's a way of being able to do that. When combined with antidepressants, it can be life-altering. It could be a life-altering process for the people who are suffering from depression. It could be huge. For people who are suffering from things like seasonal affective disorder, or SAD, there's phototherapy. We've talked about that a couple of times, basically exposing yourself to very bright light. That can help to increase the production of serotonin in your brain. Bipolar disorder, medication is probably the most effective treatment to change the person's mood. This is through a series of drugs called mood stabilizers. One of the first mood stabilizers to be discovered was a naturally occurring salt called lithium. When taken, somehow it helps to kind of regulate your mood so that you're not having high highs and low lows, which is what bipolar would be. You have that manic phase and then that major depression, and you're just going back and forth. Adding lithium kind of smooths out the bumps a little bit. So instead of going high and low, you're just kind of like, I'm having a good day, I'm having a bad day, I'm having a good day. We don't know why that is, but we just know that that happens. Lithium does have some unpleasant side effects, thirst, excessive urination, memory problems, etc. Lithium was actually for a long time added to 7-Up. Yeah. They used to add it to 7-Up, like they used to add cocaine to Coca-Cola. 7-Up used to have lithium in it. Made people feel good. Yeah, your hand shakes. You can't control your hand. Yeah. We don't really use lithium very much anymore. We use it in conjunction with a large number of other medications that are out there. And there are a lot of antipsychotic medications. Typical, yeah. Antipsychotic drugs, things like Haldol, I think it's Haldol. They are used to treat people who are suffering from schizophrenia. They help to stop the delusions and hallucinations as well as the disorganized speech and behavior. So we have medications to help people like that. The problem with these types of medications, these antipsychotics tend to have some pretty nasty side effects that people don't like. Seizures, heart rate problems, substantial weight gain. It can cause a fatal reduction in white blood cell. So a lot of people don't want those side effects and would actually prefer to just have to go through the delusions and hallucinations and try to, get through it using therapy. Behavioral therapy can be used to help treat people with schizophrenia, but it is really, really time consuming and can be very, very exhausting for somebody who's going through it. And personality disorders be treated. Yes. Moving on. I don't. Yeah, they can. You just have to work with them. All right. Now we get to the last little bit that we need to kind of quickly cover, and that is the treatment of disorders in children and adolescents. There are a lot of people out there who vehemently disagree with and are trying to stop the treatment of psychological disorders in children because your brains are still developing. So giving somebody a treatment for something when their brain hasn't, fully developed, they see it as very dangerous. And they do have a point. However, there are a lot of things that do help and can be helpful for children. More often than not, medication to help treat adolescent depression disorder, it is a thing. But they don't really want to use medication if at all possible. They want to start with therapy because, again, your brain is still developing and we don't know which direction it's going to go in. So we don't want to, screw up your brain too badly by, giving you a bunch of, antidepressants or mood stabilizers. However, when people are suffering from large amounts of depression, they will give those medications to teenagers, typically not younger than about 12, honestly. But I'm not a psychiatrist, so I don't know if they have any kind of limitation as to how early they can start people on those. Right after SSRIs were introduced for adolescent depressants, some mental health researchers raised concerns about the drugs. Yeah, we just talked about that. So moving on. Again, it's very controversial because, again, we don't know exactly what's going to happen with that medication, and we don't want to find ourselves giving treatments that are not effective / destructive. We want to make sure that they are being treated correctly. As you can see, Prozac has about the same effectiveness as CBT for treating depression. When used in combination, it's a little bit higher, but should we give somebody therapy or should we give somebody Prozac? Well, the therapy seems to work just as well, so let's just give them the therapy. Oh, here's another thing that we didn't talk very much about. Autism. Autism is a spectrum of disorders that are related to impaired communication, restricted interests, and deficits in social interaction. Autistic people can be high functioning. They can also be very low functioning. It really is a spectrum of in between. There are people who have, really, I don't want to say light autism because that's incorrect, but they have high functioning autism that allows them to be able to, function in real life somewhat normally. And then you have people who can't actually speak. What we are finding with autism is that the people who are inside, they are able to understand. It's not that they can't understand. They just cannot communicate. And it's very, very difficult for them to do so. So that's what we are finding. It's actually came out a couple of years ago. Somebody designed a computer program to help autistic people communicate. And it was pretty eye-opening when they started to communicate. One of the best ways of being able to treat people with autism on the autism spectrum is through applied behavioral analysis. And this is where you basically sit down and study a person's behaviors for a little while and then go through an intensive course of trying to get them to change their behaviors. This requires a minimum of 40 hours of treatment per week. Okay, that's a full-time job. The time commitment itself leads a lot of people to just go, well, I can't do that, so never mind. The financial drains because of it can be, really, really bad for families who are trying to help their child with autism. All right. Last but certainly not least, ADHD. This is something that's often, everybody knows something about, but nobody knows what it is. It stands for attention deficit hyperactivity disorder. It is a psychological disorder that should be treated. But also some people believe that children will just outgrow it someday. What we're finding is that adult ADHD is a thing, and they don't really so much grow out of it as they just learn to adapt through trial and error. Sometimes medication can help. The most common form of medication for kids with ADHD is going to be central nervous system stimulants like Adderall or Ritalin. And you're probably thinking to yourself, if the kid is hyperactive, why would you give them a stimulant? Because it stimulates the brain into focusing on one thing as opposed to being scattershot. Okay. If you think of a person with ADHD as a person who's got like 5 things going in front of them, taking Ritalin or Adderall, which is basically just legalized meth. Anyway, it basically forces that person to focus on one thing, and then they just get that thing done, which in children is a lot of their problem. Like my daughter really has a problem focusing, but she's 3. And so I'm not giving her Ritalin. But there are people out there who would say, yeah, give my kid Ritalin. She needs to focus. She's 3. She's fine. What we do see is that we don't see so many positive things happening because of taking the medication, but we do see a huge reduction in negative things happening. You can see on the bottom chart, non-compliance goes down, conduct problems goes down, negative verbal remarks goes way down, and interruptions go way, way down. Okay. You can treat ADHD with behavioral therapy, basically reinforcing or punishing behaviors that you want to see and don't want to see, respectively. This was kind of made fun of an episode of South Park where somebody comes in and diagnoses everybody in the school as having ADHD. And then the doctor prescribes this new therapy, which is the sit down and shut up therapy, which then they just basically scream at the children until they stop talking and shut up and sit down, which not really a therapy. Anyway, that is basically therapies and all the different types of psychological therapies that are out there. Do you have any questions that I can quickly answer before time runs out? Okay. If somebody is typing up